Hey guys, welcome to Venus Neuron, your go-to resource for medical school success. Now, today, let's break down the special spaces of the upper limb. By learning these spaces and their contents, it makes it so easier for you to go through your practical lessons. When the examiner or professor takes out an artery or nerve and they ask you, what is the name of this artery? You wouldn't be confused anymore. Now let's get started. So the first space that we're going to talk about is triangular space or medial axillary hiatus. The space borders are superiorly teres minor muscle, inferiorly teres major muscle, and on the lateral side we have long head of triceps muscle. This space contains circumflex scapular artery and vein, so they pass from axilla to the dorsum of scapula. Next we have quadrangular space, or also called lateral axillary hiatus. The space borders are superiorly teres minor muscle, inferiorly teres major muscle, medially long head of triceps muscle, and laterally surgical neck of humerus. This space contains axillary nerve, which innervates the teres minor and deltoid muscles, and also contains posterior circumflex humeral artery. And lastly, we have triangular interval. The interval borders are superiorly teres major, laterally lateral head of the triceps or humerus, and medially we have long head of the triceps. The contents are deep brachial artery and radial nerve. So imagine somebody grabs a nerve in the triangular interval and they ask you, what's the name of this nerve? So you know it's triangular interval and we have radial nerve in here, so you say radial nerve. Easy, right? Let's move on to axillary fossa. It is a pyramidal-shaped fossa which is bordered by anteriorly pectoralis major muscle and pectoralis minor. Have you heard about anterior axillary fold? It is the lower margin of pectoralis major. Axillary fossa is bordered posteriorly by latissimus dorsi and teres major muscle. Have you ever heard about posterior axillary fold? It is the latissimus dorsi muscle that makes it. Okay, now the medial border of axillary fossa is made by serratus anterior muscle, and laterally we have biceps muscle and coracobrachialis. The base of this fossa is skin or fascia of the axilla. This fossa contains, say everything that you can with the word axillary, okay? So we have axillary artery, axillary vein, axillary lymph nodes, then we have brachial plexus and adipose tissue. You might want to say axillary nerve, but it is a branch of brachial plexus, okay? That makes sense. Now let's move on to delta pectoral groove, or also called delta pectoral triangle. It is a triangular region which is bordered laterally by deltoid, medially by pectoralis major, and superiorly by clavicle. Well, hence the name, delta pectoral, deltoid, and pectoralis major, okay? Delta pectoral triangle contains cephalic vein, which it will pierce this region to join axillary vein, and deltoid branch of thoracoacromial artery. Now about medial bicipital groove. This groove is located between two structures, the biceps muscle and the triceps muscle, and the intermuscular septum on the medial side. This region contains medial antebrachial cutaneous nerve, which is the most superficial structure, ulnar nerve, partly, and median nerve, which runs lateral to basilic vein and cross the brachial artery from lateral to medial. In this groove, we also have brachial artery, which is the deepest structure. Now let's talk about the celebrity cubital fossa, or called elbow pit. It is a depression on the anterior surface of the elbow, which is bordered superiorly by an imaginary horizontal line from epicondyles of humerus. And medially we have pronator teres muscle, laterally we have brachioradialis muscle, and the floor of this fossa is made by brachialis muscle. Due to the presence of superficial veins, especially median antecubital vein, this area can be used for phlebotomy, and it is very clinically important. During blood pressure measurements, the stethoscope is placed over the brachial artery in the cubital fossa to measure the brachial pulse. This fossa contains tendon of biceps muscle, brachial artery, which bifurcates in this region and gives radial and ulnar artery. We also have median nerve here and lateral cutaneous nerve of forearm. Now moving on to carpal canal or carpal tunnel. It is an osteofibrous canal which is made by fibrous connective tissue and carpal bones, both sides making carpal eminences. We have ulnar carpal eminence and radial carpal eminence. Now you can just say the name of the bones on the ulnar and radial side that have make eminences. So on the ulnar carpal eminence, it's made by pisiform and hucous hamate. On the radial carpal eminence, we have tubercle scaphoid and trapezium. Okay, don't mix it up with trapezoid. It's trapezium. Okay. Now the borders of this canal, superiorly we have flexor retinaculum, and inferiorly we have carpal bones and their eminences. Well, basically distal carpal bones. Okay. And clinically, compression in this region results in carpal tunnel syndrome. This tunnel contains 10 tendons from flexors of the forearm and 1 nerve, and all the 10 tendons lie in 3 tendon sheath compartments. Now let's see what each tendon sheath contains. We have flexor digitorum superficialis muscle, which has 4 tendons, and flexor digitorum profundus muscle, which also has 4 tendons, located in 1 tendon sheath. Then we have median nerve, which in the forearm, this nerve can be found between the flexor digitorum superficialis and profundus. We also have flexor pollicis longus muscle, which has 1 tendon. So median nerve and flexor pollicis longus are located in 1 tendon sheath. Then we have flexor carpi radialis, which has 1 tendon and it's located in 1 tendon sheath. Okay. If you don't know about the branches of the brachial plexus, or where and how to find them on a cadaver, you can watch the brachial plexus video and also the additional video, which is how to find them. Now let's get back to the topic and talk about synovial compartments of extensors on the back of the hand. We have 6 compartments. The first compartment is made by abductor pollicis longus and extensor pollicis brevis. The second compartment is made by extensor carpi radialis brevis and extensor carpi radialis longus. The third compartment is made by extensor pollicis longus. The fourth compartment is extensor digitorum and extensor indicis. The fifth compartment is extensor digitum minimi, and the sixth compartment is extensor carpi ulnaris. 2 more to go. Now we have Guyon's canal. It is an osteofibrous canal which is made by depression between pisiform and hucous hamate inferiorly, and is covered by pisohamate ligament and volar carpal ligament superiorly. Also, Guyon's canal roof is made by flexor retinaculum. Clinically, it is significant because it is site of compression. You can also call it Guyon's tunnel, so whichever makes you feel better. This tunnel contains ulnar artery and ulnar nerve. Both of the structures bifurcate inside the canal to superficial and deep palmar branches. The superficial branch of the ulnar artery mainly forms the superficial palmar arch. And the last thing we're going to talk about today is anatomical snuffbox, or also called radiofovella or tapetriate. The snuffbox is bordered on the ulnar side by extensor pollicis longus, or basically the third compartment, and on the radial side by pair of parallel tendons of extensor pollicis brevis and abductor pollicis longus, so basically the first compartment. And the floor is made by scaphoid and trapezoid bones. If you're confused about it, scaphoid, it ends with it, and trapezoid, so both end the same way, okay? Now the anatomical snuffbox can be seen during thumb extension and abduction, okay? Try to find it on your hand. Now, the contents of radial fovella are radial artery, which passes from this region, and on its course it makes crossing with tendons of extensor pollicis longus and extensor pollicis brevis and abductor pollicis longus. But radial artery, during crossing, it lies below all of these tendons. So finally, after passing from radial fovella, it enters to dorsal region of the hand and penetrates the first dorsal interosseous muscle, and later makes deep palmar arch with the deep branch of ulnar artery. Cephalic vein is the other content. We also have superficial branch of radial nerve that can be found in this region. Now, I want to give you a little extra detail that will help you about intramuscular septa, medial and lateral bicipital grooves, and coracobrachialis, supinator muscle, and median nerve. These have some important information will help you a lot in your practicals or maybe your multiple choice questions. Now, intramuscular septa separates the ventral or flexor and dorsal or extensor groups of the muscles in the arm and forearm into compartments. In the forearm, we also have interosseous membrane between radius and ulna. Now, medial and lateral bicipital grooves are grooves separating the biceps brachial muscle from the brachialis muscle on both sides of the arm. In the medial bicipital groove, we can find many formations such as blood vessels and nerves for the upper limb. In the lateral bicipital groove, we can find the cephalic vein running up to the deltopectoral groove or sulcus. At the level of the medial bicipital groove, we can find the basilic hiatus, in which the basilic vein pierces the brachial fascia and becomes subfascial position to join the brachial or axillary veins. About the muscle that I talked. So we have coracobrachialis muscle, and it's pierced by the musculocutaneous nerve. We also have supinator muscle that is pierced by the radial nerve, its deep branch. And the median nerve in the forearm first runs between the two heads of pronator teres muscle and then runs inside the fascia of the flexor digitorum superficialis in an epifascial position. Now we also cover more information about the branches of brachial plexus in the additional video. And we talk about the basics of like what is a plexus, what do each term means, and also going through the brachial plexus in detail in the brachial plexus video, so don't miss it out. And guys, I always say that the med school is a long journey, so we're in it together. We're gonna handle it and learn everything together. So don't think that you're alone, you're not. And as I always say, if you have any questions, any recommendations for new topics, please comment in the comment section. And if this video helped you a little bit, just hit the like button. And don't forget to subscribe for new videos. And as always, stay curious, keep learning, and I'll see you in the next video.